Hello and welcome to the Clinical Update podcast, the podcast that provides you with thought-provoking clinical education from MIMS Learning that you can fit into your busy life. I'm Pat, editor of MIMS Learning, and today I'm absolutely delighted to have with me Dr Farnaaz Sharief, who's a GP and also a resilience trainer working with NHS GPs and healthcare teams. And today she's going to talk to us about finding balance in a pressured system. So welcome, Farnaaz.
Hi Pat, really good to see you again. Thank you for having me.
So please, just before we start with our questions, could you just tell us a little bit about yourself and your role?
I work as a GP. I'm actually based in the southeast in Kent, and I've always had a real passion for the mind and mental health and understanding what enables us to function effectively, particularly in high stress environments. So over the years, I've had various leadership roles in the NHS with a sort of strong focus on mental health. And alongside that, I've developed and delivered a number of resilience courses in the community and to NHS teams. In fact, last month, I delivered my 500th resilience session, which was a great milestone.
Oh, well, congratulations on that session.
Yeah, thank you.
We've said we're going to be talking about finding balance in a pressured system. So what does that really mean?
Different people look at balance in very different ways. And often people tend to think, at least some of the people that I've worked with, they sort of tend to think balance is really about achieving that perfect sense of calm and everything's working, wonderfully well. But I think balance isn't really about achieving that sort of perfect state of calm in the chaos. Balance to me is really about learning how to realign when we're pulled off our center. A lot of people working, particularly in high stress environments in healthcare fields, the pressures are constant, they're relentless, particularly around the winter times. There's clinical demands, we struggle to keep up with them. We often experience fatigue on sort of physical, mental and emotional levels. And there's a lot of expectations that we perform despite this. And I think balance is really about learning how to understand how we're functioning in these high stress environments. And it's about understanding when we need to pull back, when we need to plow ahead, connecting with our thoughts, with our energy, with our mindset, so that we're better equipped to navigate these kinds of external challenges.
Resilience is clearly a part of this, and you've said to me that it's often misunderstood. So can you expand to what real resilience is and what it looks like in practice?
I think a lot of folks as well tend to think resilience is about toughing it out. It's about plowing ahead. It's about moving forward regardless of how you're feeling. But resilience is also about pausing. It's about stopping. It's about understanding where your energy is. Are you at the top of what you might call your energy chart, and are you able to be productive and effective and efficient? Or is it one of those days where perhaps your energy is a little bit lower and you might need to proceed at a slightly slower pace? So resilience, I think, is about adapting to our energy, allowing ourselves to recover and moving forward based on what our energy levels really are. So it's having that sort of strategy to reset when we need it, and then to sort of plow forward with that confidence and determination when we've got the energy to do so. It's this small intentional pauses that really help us understand and regain that perspective, particularly when times are tough. And I always tell people that I coach that it's not just managing our energy, but it's also ensuring our energy is aligned with the effort that we put in so that we're able to sustain ourselves for a longer period of time rather than running on empty.
So is part of it perhaps allowing yourself to have those low energy days and forgiving yourself for doing that?
Yeah. So when you know that your energy is low, when you know that you're sort of feeling tired, and it might be a mental, physical, or emotional fatigue that we're experiencing, it's about being aware of that and saying, right, look, I don't have as much in my tank today as I would have liked. So I do need to step back. I do need to pace my activities. I perhaps need to pause and allow myself to reset several times during the day. And there's great techniques that we can use to bring our energy level up, Breath work is a great one. Making sure we're fueling our bodies with the right foods that sustain us is a great one. Hydration is really important and often overlooked component of managing our resilience. I don't know if our listeners know this, but if we lose 2% of our body water, we lose our ability to think clearly. And that affects our resilience on a day-to-day basis, right?
That's amazing. Only 2%.
Yeah. And often, I've worked with teams of people where they're so busy during the day serving their patients or managing their workloads that they forget to eat or drink. And that has an impact on the amount of energy they have to deal with their responsibilities. And that has an impact on their ability to be resilient, particularly in high-stress environments. So if we wind that back and ensure people are, as an example, eating the right foods, hydrating well, then that, of course, enables them to function better.
Yes, that's such a basic thing, but I guess it's very easy to forget in a very busy day in practice when you've got appointments back to back and lunch hours are a thing of the past. Must be difficult.
Yeah, absolutely.
Healthcare leaders and teams are under immense strain, especially with winter coming up, and we've had the news recently that they think it's going to be not such a great year for flu. What practical steps can people take to protect their own balance while supporting others?
I think the most important step is to be aware of how you're feeling and to act in accordance with that. If we are aware of the fact that our tank or our energy levels are a little bit low and we slow our pace down, we're able to manage that a lot better. Whereas if you notice that your tank or your energy levels are low, but you carry on plowing ahead, at 100 miles per hour, then you're more likely to hit burnout faster. So I think awareness of where you are in terms of your energy levels is really, really important. And once you know where you are, creating those very small but consistent, I think consistency is key here, consistent moments of recharge. In clinic, for example, I've had a really busy morning surgery today, and often it is, we spend 10 minutes with patients and it's one after the other. So if I do have a sort of challenging consultation, or if there is something that perhaps stresses me out a bit, I will take a few minutes to recharge before I call my next patient in. Because, what happens in that consultation is my responsibility, and I don't want to enter a consultation feeling depleted in terms of energy. So awareness of the fact, how are you feeling? And then taking a few minutes to recharge in between challenging situations is really important. And recharging can be something as simple as, making sure you're sitting upright so your energy flows upwards, resetting your breathing, perhaps refocusing your thoughts, or even getting up and grabbing a cup of coffee from the reception desk. Do something to change your physical state so that, the blood's flowing differently in your system, even if it's for 2 minutes, and allowing your energy to sort of move in an upward direction. And these are the kinds of frameworks. These are just a few examples I've given you, but we have a lot of frameworks that we can use to help people pause, reflect, and deal with their challenges perhaps with a bit more clarity rather than reacting to them if they're feeling very, very tired. And what's nice about these frameworks is that when people use them and they use them again and again and they find that it works, then it can really transform the way in which they function when they're dealing with stressful situations.
So it's about creating a habit of doing those little recharges and looking after yourself a bit more.
Yeah, I'll give you an example. So I always have really important conversations on my feet. And I always do that because I feel it's an important conversation. I want to be at my best. I want my energy to flow upwards. And if I'm sitting or slouching, then I'm sort of turned in on myself. I know my energy is going to be going in a downward direction. And that's going to affect my ability to think clearly and communicate and articulate what I want to in a very practical way. So when there are important conversations, I'm on my feet, I have these conversations. And I can do that with patients as well because we have standing desks in clinics. And I'll explain that to them. I sort of say that, look, it is the afternoon. It's been a long day. I'm on my feet because I want to be at my best for you. And it makes a difference. Often patients will also stand up and have conversations with me. Or if I'm doing that during a coaching conversation, sometimes I'll take a walk with some of my clients. We're out in the fresh air. It makes such a difference when you know how you're feeling and you can adapt to function effectively in your environment. Yeah.
That's really interesting. So patients don't mind and might actually welcome it, having a stand-up conversation as part of the consultation with you?
Yeah, I've certainly not had anyone raise objections. It makes a difference when I talk to them about it. And I say, look, the reason I'm standing behind my standing desk is so that I can have a productive, meaningful conversation with you. Sometimes it is usually in the afternoon, or if it's between patients in a long morning clinic, I'm like, I'm doing this so that I can think clearly, I'm on my feet, I want my energy to move upwards. You're welcome to stand and have the conversation with me. Of course, if they're elderly or if it's a pregnant lady or someone that might have a baby and they prefer to sit down, that's absolutely fine. And I will meet them at that sort of level to do any examinations or have any sort of conversations as well. But most of them are like, oh, that's absolutely fine. Go ahead and do what you need to do.
Oh, that's absolutely great. Just to recap, the things that you could do to recharge yourself, like in between patients, are breath work, hydration, change of posture.
Your state, yes.
Your state of state.
I love this quote by Einstein. And he says that you cannot solve a problem in the same state that created it. So often if you are feeling frustrated or tired, or there's a bit of emotional or mental or physical fatigue, and if we hold on to that for the day, it wears us out a lot quicker. But if you're aware of how you're feeling and you change your state, it makes such a difference. And I've seen this a lot with receptionists. I've done a lot of work with some practice managers and receptionists in primary care. And often they're on one call after another, and sometimes they also have challenging conversations, and it becomes really hard for them to just keep going. So a technique we use with them is they often, if they feel that they need a little bit of a break, 2 minutes, and they'll go outside for a very quick walk. And during that time, I often encourage them to look at the treetops or look at the rooftops, safely, obviously. When you do that, and listeners might want to do this, if you're walking and you're looking at the treetops or the rooftops, you automatically assume a posture where your spine is straight, your shoulders are back, your chin is up. And that allows for your energy to move upwards. And then they come back to their phone calls or their consultations and they're feeling different, they're clearer, their energy is in a much better place. And then they're able to deal with what they need to deal with a sort of fresher, more clear state of mind.
Yeah, that sounds really practical advice. So how can healthcare leaders maintain clarity when they're constantly faced with competing demands and pressures?
So if we think about the things that take our clarity away, it's often our own internal noise, right? It's often the way in which we perceive what's happening around us. And we can't always control what's happening around us. We can't always control the system, but we can definitely control how we center ourselves within the system. So I think the first step in achieving that clarity is recognizing again how we're feeling, that awareness of I'm tired, my mind is cluttered, I'm feeling overwhelmed, I'm feeling anxious, whatever it is, that awareness of how you're feeling. And then the second thing is to center yourself in that. So to take that mindful pause. And the most practical way of doing that is to change how we breathe. Now you might notice when you're stressed or you're anxious or you're angry, the rhythm of the breath becomes faster, right? But when you're calm and relaxed, we breathe differently. It's often a lot slower. And the first thing we tell people to do when they're having a panic attack is we tell them to slow the rhythm of their breath down. So the first step in achieving clarity is one, to become aware of how we're feeling. Secondly, to change how we breathe, because that allows us to change our state. And then to deal with what we need to get done. And interestingly, that process is 4 things. The steps that we can take in order to gain clarity, particularly when we're really busy or working in high stress environments, there's 4 steps. There's A, which is being aware of how we're feeling. B, which is breathe differently. We can use the straw breath or the box breathing. That helps us change our state. And then D is dealing with it after we've done the sort of ABC. This sort of structured approach really helps us unpack a very complicated or complex situation rather than react to it in an emotional way. So when we step back, when we reflect, this technique allows us to perhaps reframe the challenge that we're dealing with so that we're able to look at it in a different light and perhaps make better decisions when it comes to dealing with this. And it also helps us reduce any overwhelm that we might feel when it comes to dealing with stressful situations.
Yes, so we might feel a lot better about what's
Yes.
happening as well, which is really important.
Yeah, and when we feel good, we do good, right? Often when we're feeling not so good, we just carry on, and then the outputs or the outcomes are not that favorable. But when you feel good, the outcomes are more likely to be favorable, and clarity enables us to feel good so that we have more favorable outcomes.
Brilliant. And I know you've worked with a lot of teams over the years, and what are the common barriers that you see when people are trying to find this balance or build up their resilience?
I think there's three things. And often in healthcare teams that I've worked with, one of the biggest barriers is guilt, where people feel that they've always got to put other people first before they stop and they look after themselves. And I see this so many times when people realize that for them to provide sustainable care, they've got to be functioning at the top of their energy chart. They've got to have enough in their cup to pour out of it. And it's important for people to step back and look after themselves before they sort of immerse themselves in high stress environments and look after others. Another thing that I get to see a lot of is often people think that change means you have to do a whole bunch of big things. There's a belief that change requires a big shift, but it actually doesn't. It's often when we make small, consistent changes that we benefit from the biggest differences, right? So water, for example, drinking enough, 2 to 3 liters of water a day, can sometimes make the biggest difference in how we function on a daily basis. Something as simple as changing the quality of the last hour or the last 30 minutes before we go to bed can make a huge difference in the quality of our sleep.
Oh, okay.
And we can certainly talk about that. So I think often people think in order to make a big difference, I've got to make a big change. But it's the opposite. To make a big difference, you need to make a small change, but practice that consistently.
Right. So it's back to habits again. Yes, if you can talk a bit about that's intriguing about the half an hour before bed. What are your thoughts there?
So on some of the programs that I deliver, we talk about, in fact, we've talked about it on MIMS as well. There's 4 pillars that enable us to function effectively in high stress environments. How we fuel, how we refuel, our form and our focus, right? So refueling is how we recover from the challenges that we deal with on a daily basis. And refueling is essentially the quality and the quantity of sleep that we get. Now, a lot of times, folks tend to be really busy, right, during the day, and the mind is going at 100 miles per hour. So when we get to bed, our mind is still going at 100 miles per hour, and it's very difficult for us to fall asleep or stay asleep. And often, a lot of folks will wake up in the middle of the night and they've got this one thought, and then everything spirals out of control. And then we've all experienced that, haven't we? I can see you nodding as well.
Yes, we have.
I always say to people that there's 3 things to think about if you want to change the quality of your sleep. The first thing is, before you get to bed, for the 30 or 60 minutes before you can get to bed, make sure the quality of that 30 or 60 minutes is where you're calming your mind. So C for calm, right? And calming your mind might be things like avoiding your phone, avoiding anything that's too stimulating like coffee or tea or caffeinated drinks, or anything violent on TV, things like that. And what you want to do instead is things that will really calm your mind. So it's a good time to meditate, to do some breath work. Chamomile tea is very good at relaxing the mind. It really settles the mind down. So having a calming routine at least 30 to 60 minutes before you get to bed. When you're driving at 70 miles per hour on the motorway, if you hit your brakes, it's going to take a bit of time for your car to slow down, right? It doesn't stop immediately. So similarly, before we get to bed, you're hitting the brakes and you've got to allow your mind to slow down. And that 30 minutes before bed, making sure we're not stimulated and we're actually calming our system down, enables us to improve the quality of our sleep, right? And I work a lot with menopausal women, and often they're not comfortable. So making sure that you're comfortable and cool before you get to bed is really critical. So have a fan on, have a window open, make sure your clothes are nice and light so you're not going to be waking up with sort of hot flashes or night sweats and things like that. So making sure you're comfortable and cool before you get to bed is really important. And the third C is around consistency. And I think this is often the most overlooked factor in sleep. But having a consistent bedtime and a consistent wake time, even on weekends, significantly improves the quality of our sleep, right? And I'd encourage folks that are listening to give that a shot, even for a week. But get to bed at the same time and wake up at the same time and look at how it changes the quality of your sleep. It's remarkable.
Excellent. That's really practical advice. And I love the way that the things you're suggesting are all free.
Yes.
Water, breathing, sleep routine. You don't need to buy anything, and as you say, it's not big changes, but it's things that could be really important.
And actually, we talked about people feeling guilty. We talked about that belief where folks might think that, making a big change requires a big difference, but it's not. It's these kinds of small, consistent things. And often the third thing is often people say they don't have time to do this. I do understand that often we are juggling a lot, particularly if you've got kids or family at home, and there are so many different responsibilities that we have to sort of manage. And I often encourage people to think of their own mental health and well-being as a priority, rather than thinking that we don't have time. Maybe think about actually, how do I want to prioritize on my well-being? So we've all got 24 hours in the day, and carve out how you want to use that time. So it's a question of priority rather than time. And even if you're giving yourself 10 minutes in the morning or 10 minutes in the evening, that's your time. That's your protected time to look after your mind so that you can build your resilience consistently over a long period of time.
Great. So if somebody listening today feels overwhelmed, stuck, what one simple thing could they do to start finding a better balance?
I think you said the magic word, Pat. I think you said one. And I'd say that's probably the thing that people need to start thinking about, is actually what one thing from this conversation are they going to be changing? One thing do they need to start finding that balance? We've talked about the 4 Fs, and we can sort of people can have a look at that course if they want to. But think of one thing that you want to change and use that consistently. Once you've mastered that, move on to the next thing, right? So it might be something in your diet. Maybe you're eating a lot of sugar, or you're having foods that are not likely to sustain you, or maybe you're not drinking enough water, or maybe you're not moving enough. So what one thing from the conversation that you're taking away from today are you going to apply? And once you apply it consistently, and then move on to the next one. It might be that it's rest. It might be that you're wanting to change your perspective about certain things. It might be that you need to be thinking about how you spend the last 30 or 60 minutes before you go to bed. But when you pick the one thing and engage with that with intention on a regular basis, then you're more likely to build a sustainable habit. And you don't even have to think about it after you've done it for some time, right? So these small, repeatable habits will really strengthen our ability to rise above our daily pressures. And these are the habits that sort of will tend to support our clarity. They'll help us, enable us to be calm in high stress environments so that we can act meaningfully rather than react out of frustration.
And I suppose individuals can get into habits, but I guess teams can start to try and foster habits as well. And are there other sort of team habits that you would recommend?
With teams, I always think when people talk about the challenges that they experience, and they can use these challenges to connect with others in a work environment, it can really, really be powerful. So if you're able to talk to your colleague or your manager about the fact that actually my energy is not so high today, I'm feeling really, really low, and you tackle that early on, so you're managing it proactively, perhaps there's an opportunity for you to step back from maybe the front desk and maybe do something that's a little bit lighter, or maybe have a shorter shift, or maybe, step outside and take more breaks, or grab a standing desk, and spend some time on your feet. So there are options that are available. And I think our ability to find solutions is often better when we are thinking clearly, when we have slept better, when you are eating the right things, and when we're coming from a sort of a higher energy place rather than a lower one. For winter, we're sort of heading towards winter now, and I know certainly from working on the front lines that pressures on healthcare teams can be very, very immense during this time. I'd encourage people to really be kind to themselves. Step back when you feel you need to, give yourself the rest when you feel you need to, make sure you're looking after how you fuel, how you refuel, your form. We talked about how you're sort of sitting and walking around, looking at the treetops, and also focusing on the things that matter to you. There's a lot of people out there that will plow ahead regardless of how they're feeling because they want to make the meaningful difference for their teams, for their patients. But really, important for folks to look after themselves as well. And I hope that message from this discussion comes out loud and clear for people to be kind to themselves.
Absolutely. Well, thank you so much. Thanks very much for joining me today on the podcast.
Thank you for having me. It's always a good chat with you.
Don't forget you can claim CPD credits for listening to this podcast, and to get your certificate along with key learning points you just need to go to our website at mimslearning.co.uk. You've been listening to the MIMS Learning Clinical Update podcast produced by Jude Owen, and I hope you'll join us again next week. Thanks very much for listening.